We're going to take a short tour of the wards. We'll start down in Ward 1. This is our men's ward, mostly medical patients. Call it Ward 1. And we have 5 numbered wards. There are 13 beds in this ward. Between each ward there's a nurse's station. We have a nurse's station here where the nurses keep their records. And we move into Ward 2. Ward 2 is also a men's ward. And we try to keep it as a surgical ward. So most of the patients here have had surgery or are waiting for surgery. There are 10 beds in this ward. Ward 3. Ward 3 is a women's ward. We have 8 beds in this ward. Again, it's supposed to be medical patients. It's not strictly kept medical, but in theory it's for medical patients. And the nurses station for Ward 3, 4, and 5. Ward 4, another women's ward with 6 beds. It's supposed to be the surgical women's ward, and it's not a strict division. We just put patients where we need to put them. And Ward 5 is also a women's ward. There are 10 beds here, but it's also used for older children. So the only patients we have right now are 2 older children. And we're almost empty right now. So we've been through Ward 1, 2, 3, 4, and 5. This is a pediatric ward. There are 37 beds here. And all of these patients are pediatric patients. We have medical and surgical patients in this ward, so we don't separate them out. So this is isolation ward. It's where we keep our infectious diseases, bad sores, meningitis, hepatitis, those kinds of things. It's divided into 3 sections. In this first section, isolation 1 is mostly for infected sores, wounds, and those kinds of things. So all of these patients have bad infections. We don't want to mix with the rest of the patients. There are 8 beds in here. And the second part of isolation, isolation 2, is for other infectious diseases such as meningitis and hepatitis. And the third part of isolation is for TB patients. So these are it's a TB ward. Patients who are with TB who need admission for some reason or another, they're not ready to go to Alafia-Tinga. They'll start out here. Or if they're in Alafia-Tinga and get sick, they'll be admitted here. So they're not mixed with the other patients. This is our maternity ward. Patients who are in labor or have delivered or have complications of pregnancy. It's run by our midwives, and our midwives take care of all the normal deliveries. We only manage those that are complicated, but this is our maternity ward. They stay. That's right. Awesome. So nurse's station here. We do have an incubator that works sometimes. Sometimes it doesn't work, and we're trying to get some new ones. So now we have oxygen piped in here for the babies if they need it. In the delivery room, here we have 2 delivery beds. If a patient needs a C-section, we take them to the operating room. We don't do the C-sections here in the delivery room. And then we have one final room. This is our staff ward. It's sort of semi-private, and so we put staff patients here if they need admission. That's a brief tour of the wards. If you come and see us, you'll learn a lot more about them.